Thank you, Dean Finnegan. So I'm going to be co-presenting with Zoe Cow, who's a PhD candidate in our program in the Division of Health Policy and Management. So networks are salient in our everyday lives. Social and professional networking sites have made our networks more visible and allowed people to capitalize on their social circles and the social circles of others. We've also become more aware of the impact that networks have on our everyday lives. So we've seen the influence that our social networks have on our habits and lifestyle choices, our chances of getting the flu, and our chances of finding a job. So we're really reminded on a daily basis that we live in a connected world. Networks, in their essence, describe interactions. Formally, a network model consists of a population of individuals and connections between those individuals. These connections can represent a variety of relationships. These might be professional interactions, friendships, or sexual partnerships. And it's over these connections that things spread. And depending on the nature of the relationships of interest, these might be things like information, attitudes, behaviors, and of course, infectious disease, which is my area of research. So network structure has a huge influence on how a disease spreads through a population, but we often don't know the network structure. Here are two examples of different network structures. Individuals in these populations have the same number of contacts on average, but you can see these structures look very different. So on the left, we have what's called a random network. And here, individuals are just randomly connected to each other with very little pattern or variation in behavior. On the right, we have a scale-free network, and this network is characterized by most people having just a few contacts, one or two connections, whereas then we have a small number of extremely connected individuals, and those are the large green circles. And those individuals act as hubs in the network, and so if they become infected, then they're going to rapidly spread the infection throughout the network. So network structure and its influence on how a disease spreads has been fairly well established. But what has been less studied is how network structure influences the effectiveness of interventions aimed at preventing or controlling infectious disease spread. And so that's really the focus of our research team. So sexually transmitted infections like chlamydia and gonorrhea are two examples of infections that spread over a sexual contact network. These infections are treatable with antibiotics, but they rarely produce symptoms, so a person often has no idea that they're infected. When left untreated, these infections can lead to complications, such as a painful condition called pelvic inflammatory disease that can lead to infertility. And so it's really important to diagnose these infections and treat people. So because there are very few symptoms, routine testing is really the foundation of STI control. For example, the US Centers for Disease Control and Prevention recommend that sexually active women under the age of 25 and men who have sex with men of any age be tested annually for STIs, whether or not they have any symptoms or think that they have an STI. But routine STI testing really focuses just on the individual, right? And it ignores the broader sexual network of which a person is a part, including potentially infected individuals. So while we can treat that person who tests positive for the STI, we may be leaving infections in the network, allowing the STI to spread further, but also putting our original patient at risk of reinfection. So routine STI testing can be improved by combining it with contact tracing. Under contact tracing, when a person tests positive for an STI, they're asked to provide the names and contact information of their most recent sexual partners. Staff then contact those partners and offer them testing, and hopefully they get tested. And then if any of those partners test positive, their most recent sexual contacts are traced, contacted, tested, and so on. And so this can lead to many more infections being treated. The downside of contact tracing, of course there's a downside, right, is that it's extremely labor intensive. You have to go and find these people, contact them, test them. And so we really need to think about whether or not the benefit of treating these additional STI cases is worth the cost of doing so. It also seems clear, right, that contact tracing is going to be influenced by the network structure because this process is essentially tracing through the sexual contact network. And so the question is, what does this relationship look like? How does network structure influence the effectiveness of contact tracing? So now I'll hand it over to Zoe to present our model.
Thanks, Eva. So to systematically compare the performance of different interventions across different network structures, we created a simulation model of a hypothetical STI spreading over a sexual contact network. And a simulation model is a simplified version of reality that allows us to experiment with different scenarios to see what might happen. So to compare two STI measurement strategies, we created a simulated world with routine STI testing only. And also, we also created another simulated world with both STI testing and contact tracing in the same simulated world. The metric we use for evaluating different intervention is the annual number of STI cases. In addition, we introduced the structure of sexual contact network to our simulation model, including the random network and the scale-free network. In the random network, individuals have equal chance to make sexual contact with anybody in the population. In comparison, in the scale-free network, there are some hubs, which means that individuals have higher number of sexual partners compared to the rest of the population. Therefore, we expect that these hubs will facilitate STI spreading over the scale-free network. Here is an example from our simulation model. So, as we expected, the number of STI cases in the scale-free network is 61% higher than the number of cases in the random network. After introducing contact tracing in the random network, contact tracing resulted in lower number of STI cases, reduced the cases by half. However, in the scale-free network, contact tracing resulted in higher number of STI cases, which is counterintuitive because contact tracing should always treat more infection in the population compared to routine STI testing only. And why is that? The key is the highly connected individuals in the scale-free network. These individuals are easily infected because they have many partners. And having many partners also means that they are more likely to be named as a contact through contact tracing. Therefore, these highly infected individuals enter into a cycle of infection, being traced, being tested, treated, only to be quickly reinfected again. This suggests that in a scale-free network, contact tracing should be complemented by interventions aiming at reducing risky sexual behaviors. So the research from our team indicates that network information is very important for informing infectious disease policy. Intervention can have very different impacts on the disease outcome depending on depending on the underlying network structure. So in continuing work, we are exploring the cases where optimal policy decision is different depending on the network structure. And in these cases, we can quantify the value of information and determine whether it is worth collecting more data in a population's contact network. Thank you for your attention.